Georgia Schaefer.
Georgia, nice to meet you.
Brian, because that's
Yeah. Good to see you. Thank you. So important to talk about this. Let people know.
Yeah.
Yeah, thank you. Everybody ready?
Yes.
You guys all ready? All right, well, thank you, and good afternoon to everyone. And I want to thank everyone who's joining me here today to talk about a really critical issue. And I especially want to thank the Tri-Cities Community Health for hosting us here today at this facility. We are here today really to raise the alarm and to set the record straight on how the Republicans' reconciliation bill, I call it the big ugly bill, will be devastating for healthcare in America, because the cold, hard reality is that Republicans signed into law, it's law now, a bill that cuts Medicaid, it kicks people off of their health care, it will drive up health care costs, and it will shutter health care providers across our country. Under this bill here in Washington State, we are expected to lose between $31 billion and $51 billion, with a B, dollars in federal Medicaid funding over the next decade. We are looking at the largest ever cuts to Medicaid, which we know here in Washington State as Apple Health. At least 250,000 people in Washington will lose their Apple Health coverage under this bill, and that is really devastating. But it's not just the people who rely on Medicaid who are at risk, because Republicans also refuse to extend the important tax credits that lower the cost of health care for middle-class families and small business owners. So everyone needs to understand that right now, that will send premiums skyrocketing, because those tax credits are saving millions of people across the country hundreds of dollars a month. Here in Washington State, we have over 200,000 people who are saving around $1,300 a year on average. Letting that expire and letting the floor drop out from under those families will mean as many as 150,000 more people will lose coverage when they are priced out of the state's healthcare exchange. And even those who are not priced out entirely are going to take a huge hit to their family budgets. I'm going to give you an example. 60-year-old Washington State couple that make $82,000 a year will see possibly their premiums triple from just under $7,000 now to over $22,000 a year. That is already coming down the pike for everyone. Marketplace insurers are right now requesting the largest premium increase in more than 5 years for everyone. In Washington State, health insurers have already requested to hike their rates by over 20%. And the damage goes further. The healthcare cuts in Trump's bill are going to hit hospitals and healthcare providers right in their own budgets. Hospitals here in Washington State alone could lose $262 million in Medicaid revenue every year, forcing our hospitals to lay off staff or cut services or possibly close their doors. We have several rural hospitals that are fighting now to survive, not to mention rural labor and delivery units that are hanging on by a thread. The bill that the Republicans passed puts all of them at serious risk. This is bad news for everyone, no matter if you're on Medicaid or Medicare or even employer-sponsored coverage, because it hardly matters what insurance you do have when you don't have a hospital to go to get care anymore. We are here today because Central Washington is going to get especially hard hit by this. The 4th Congressional District has the highest Medicaid enrollment of any district in our state. This is an area where lots of working class families benefit from the health care tax credits. And this is an area with a health care provider shortage now. And the rural hospitals and community health centers, like the one we're in today, are crucial to families. So families need to understand what is happening, and I want them to know we are going to continue fighting back. We want to prevent the damage from these cuts, and we want to support our community health centers and hospitals like the one we're at today. I have introduced legislation with my colleagues to reverse those painful cuts to Medicaid And we are also working to extend the ACA health care care tax credits. But the hard truth that we have is Republicans are in the majority. We need them to join us to fix this, or they're going to be held accountable. Americans, I got to tell you, just do not want to see our community health care centers shutter. They don't want to see the hospitals they rely on for their care to be shut down. They don't want to lose their health insurance, and they don't want their neighbors to either. That is why we are here today. We want to get the word out. We want to lift up the voices of our healthcare providers and put a very bright spotlight on what these healthcare cuts mean for real people and real community health centers and hospitals right here in Central Washington. I'm very proud to be joined today by a number of people who can speak to this personally, and we will start with Christy Needham. She's the CEO of Tri-Cities Community Health. So, over to you.
Good afternoon. Thank you, Senator Murray, for your leadership and for standing with us today. My name is Christy Needham, and I am proud to serve as the CEO at Tri-Cities Community Health. We are a federally qualified health center that serves more than 29,000 patients within 39 zip codes across the Tri-Cities region. Nearly 70% of the people we care for rely on Medicaid to access essential health services, including primary care, dental, behavioral health, and preventative care. The proposed cuts to Medicaid are not just numbers on a spreadsheet. They're decisions that will directly affect real people. These are working parents, children, seniors, veterans, and people with disabilities, many of whom already face daily challenges just to make it to their appointments. Barriers like housing insecurity, language access issues, or transportation challenges, taking away their coverage pushes them even further to the margins. If Medicaid is cut and we're unable to sustain our services at current levels, the reality is that our patients will have nowhere else to go, except the emergency room. And we all know the emergency rooms are not the right place for managing chronic conditions like diabetes, asthma, or for treating depression, or for children to get their vaccines. It's more expensive, less personal, and already overburdened. When people can't access timely care, small health issues become crises, and the entire healthcare system is going to pay the price. At Tri-Cities Community Health, we believe healthcare is a basic human right. We exist because people matter. Medicaid gives our patients stability, dignity, and a pathway to better health. Cutting Medicaid puts this all at risk. We deeply appreciate Senator Murray's commitment to protecting Medicaid and ensuring our patients are not left behind. We urge all of our leaders on both sides of the aisle to reject these harmful cuts and stand up for the health of our communities. Thank you.
Thank you. Good afternoon. My name is Brian Gibbons. I'm the president and CEO of Astria Health in Sunnyside, Washington. Appreciate the opportunity to be here today. Thank you, Senator Murray, for inviting us. I'm here to speak plainly because this situation demands it. The Federal Budget Reconciliation Bill, H.R. 1, poses a catastrophic threat to rural health care. If left unaddressed, it will destabilize hospital systems like Astria Health and leave communities without access to essential care. Astria Health's hospitals are now in immediate risk. Our commitment remains unwavering. Hospitals, like those with Astria Health, continue to provide emergency care to everyone who walks through our doors, regardless of their ability to pay, their insurance coverage, or their immigration status. Not only is it the right thing to do, but we're also required under the EMTALA laws. I want to take a moment to highlight an often overlooked but critical component of our healthcare system, EMTALA, that is the Emergency Medical Treatment and Labor Act. This federal law mandates that any hospital with an emergency department, including ours, must provide a medical screening and stabilization treatment to any patient who comes through our doors, regardless of their ability to pay or their insurance status. It is a vital safeguard, ensuring that no one in crisis is turned away. But here's the reality we're facing. As thousands of our neighbors are expected to lose Medicaid coverage, more patients will arrive at our hospitals without insurance and without any means to pay. Under EMTALA, we will continue to provide that care, but without any meaningful reimbursement reform, the financial pressure on our hospitals becomes unsustainable. We're proud to serve everyone who walks through our doors, but here's the truth. The math no longer works. We need Congress to recognize that EMTALA, without adequate funding, is an unfunded mandate, and it puts rural hospitals like ours at significant risk. In communities like ours, where Medicaid is currently the lifeline, cuts to the reimbursement shift to the entire burden onto the hospitals. These are communities with very few large employers and limited access to private insurance. As Medicaid coverage shrinks, the number of uninsured patients grows, and so do the hospital's losses. No healthcare system can absorb these costs forever. Now, we sounded the alarm. We worked closely with our congressional delegation. We spelled out exactly what would happen in Toppenish, Sunnyside, the Yakima Nation, and in surrounding areas. Congress passed H.R. 1 anyway. We call that what it is, a betrayal of our country's most vulnerable families. There's a dangerous misconception circulating that H.R. 1 only affects healthcare access for non-citizens. But the truth is far more alarming. When hospitals like ours are forced to close departments, consolidate services, or even shut down entirely due to funding shortfalls, it's not just one group that suffers, it's everyone. These are not theoretical discussions. The discussions are happening now. Rural communities, working families, seniors, and children all lose access. H.R. 1 doesn't draw the lines, it erases them. It threatens the stability of the entire healthcare system. Every option on the table is being evaluated through a single lens. How do we preserve access to care for the people who depend on us? I speak today for our neighbors in Sunnyside and Grandview, Granger, Toppenish, White Swan, Wapato, Mabton, Parker, Buena, Zilla, and Union Gap. These are not line items in a budget. They're families, farm workers, grandparents, children, and they all deserve access to care. We call on Congress to fix the Medicaid reimbursement now, restore fairness, and ensure access to care is never determined by zip codes or income. Anything less is a failure of leadership, and we can't stay silent. So thank you. Thank you very much.
Good afternoon. My name is Nieves Gomez, CEO of Columbia Basin Health Association. Thank you for the invitation, Senator Murray, and my fellow leaders. At Columbia Basin Health Association and across community health centers nationwide, we serve a clear and critical purpose: to provide affordable, accessible, high-quality health care to those who need it most, regardless of their ability to pay. That mission is now being tested by recent changes to Medicaid. Changes that threaten the health of our patients, the strength of our programs, and the future of care, especially in rural communities like the ones we serve. Medicaid is the backbone of how we deliver care. It supports everything from pediatrics and prenatal care to mental health and chronic disease management. In rural areas where we're already too few providers and too many barriers to care, cuts to Medicaid have a magnified impact. Although policy in some ways has a delayed impact, we already feel the effects today. Fewer providers means longer wait times. In Tri-Cities alone, the wait time for primary care appointment for new patients is 3 to 6 months. Preventative care is delayed. Wraparound services like behavioral health, nutrition, counseling, and outreach face reductions. And it becomes harder to grow, update, or expand the care that we can offer these patients. Simply put, cuts to Medicaid are cuts to rural health care and cuts to essential life-saving programs. The patients most impacted are often those who work the hardest and have the least, including agricultural workers who power our local economy. Health centers like CBHA aren't just clinics. We're a public health safety net and an economic foundation of the communities that we serve. We can't meet growing needs, invest in care, or plan in the future when Medicaid program is consistently at risk. We fully support improving the system. Rooting out waste, fraud, and abuse is important, but those efforts must not come at the cost of access for our most vulnerable patients. Community health centers are how we make America healthy again, by delivering smart, cost-saving preventative care in every corner of this country. But we can't do that if the foundation of our funding is weakened, and we urge our leaders at every level to protect Medicaid because it protects people, workers, and communities that keep our region strong. Thank you.
Good afternoon. I'm Cynthia Flynn. I'm the managing partner at Columbia Birth Center. Like many of the rural and critical access hospitals, Columbia Birth Center is committed to serving those who are covered by Medicaid. However, birth centers receive less than half as much as hospitals do for the care that we provide and for the exact same service, even though our costs are the same, or in some cases more. Currently, Medicaid doesn't even reimburse at all for some essential services, like taking care of the baby when it's born. They do reimburse us for moms at a very low rate, but not at all for babies. And so it's already very hard for us to survive given these discriminatory practices. Those who lose Medicaid, who will lose Medicaid eligibility because of these cuts, will still give birth. I mean, you might not get cancer, you might not have a stroke, but you were born. All of us were born. And they will give birth. And what will happen is they'll show up at the emergency room without having had any prenatal care and with who knows what underlying problems that could have been addressed had they had some. And that just puts all the more strain on rural labor and delivery units, which are already under huge stress. I don't know of a single L&D unit in the nation that pays its own bills. It's hospitals have to cost shift to cover L&D as it is. And I've worked in countries where only the rich had prenatal care. It does not go well. And the result already of our very stressed maternity care system in the United States is that we rank 69th worldwide in maternal mortality. 68 countries keep their moms alive better than we do. In fact, we had a 30% increase in maternal mortality just from 2019 to 2020, even though 80% of these deaths are preventable. And reducing access to Medicaid and Medicaid reimbursement for the providers and the hospitals is only going to make all that worse. We know that birth centers are part of the solution to this maternity crisis. We have better outcomes for matched clients. We have fewer interventions, fewer complications. We save money right off the bat. But you know, we do have to survive. I'm like all the rest of the speakers. And the way things are right now, we can barely survive. If access is reduced and if those cuts to reimbursement happen, I'm not sure we can stay open. We did get a big grant. All the labor and delivery units could apply for it last year for the state. That kept us going another year. But this is, you know, doesn't work as it is, never mind if we get cuts. The other thing that's true in these rural areas, like the Tri-Cities, is the hospital labor and delivery units are really stressed for staff and beds. So, for example, we had a case that the woman became a severe preeclamptic. She had to be hospitalized immediately. There were no beds at Cadlick, where we normally transfer. There were none at Trios. There were none at Prosser. There was no place for this woman to go. Her life was at risk. And one of the things the birth center does for this community is by taking care of people who don't need medical care, it frees up a bed for somebody who does. So, you know, I'm saying the same thing everyone else is saying. We cannot just say, oh, well, too bad, so sad. We have to get this reversed because as it is, we're hanging on by a thread. The whole system is about to implode as far as I can tell. And all that means is more dead people, more dead moms and babies, and it's not acceptable. Thank you.
Hello, I'm Dr. Georgia Schaefer. I'm a family medicine physician at Tri-Cities Community Health. And at Tri-Cities Community Health and at health centers across Washington State, we are deeply concerned about the projected decline in patients covered by Medicaid and marketplace insurance in the coming years. This shift threatens the financial stability of community health centers like ours and may force reductions in the vital services that we provide. As a healthcare provider, I take great pride in delivering preventative, consistent, and whole person care. My patients trust that we will be there for them, not just in times of crisis, but throughout their entire healthcare journey. When patients lose access to insurance, they often delay or forgo care altogether, and that increases the risk of severe health complications and results in more visits to overcrowded and costly ER visits, as all of our speakers have said. A recent study found that community health centers saved Medicaid $38.6 billion by focusing on prevention and reducing unnecessary ER visits. That's not just good policy, it's smart, compassionate care. At Tri-Cities Community Health, we exist because people matter. We remain committed to providing the wraparound care our patients need and deserve, and that goes far beyond the exam room. To continue this mission, we have to have policies that protect and expand the access to affordable health care coverage for all. On a personal note, I'd like to add that my family and I have been recipients of Medicaid. It was my first insurance in this world. It was the insurance that got my mom through her pregnancy with me. And without it, we would have had no access to health care insurance, and it would have prevented us from accessing care. I am just one of thousands of success stories that show what consistent access to healthcare can do, and it is a benefit that every Washingtonian deserves access as well. Thank you.
Thank you all very much for telling everyone the impacts of this, and I'm happy to answer any questions, but we are here today to raise this story so people understand what is coming and to help us take the word back that these need to be repealed. Any questions? Yes.
So we have written many stories on this topic, and every single story we get the same response. Well, these are people who are getting Medicaid fraudulent. They're not working. We're going to put them to work, and they'll earn their health care benefits. How do we address that?
Well, it's not true. It's absolutely not true. In fact, the vast majority of people on Medicaid are working today. They are working today. Many of you see them on a daily basis. But the ones that are not are usually taking care of somebody. They're disabled themselves, sick for whatever reason, absolutely cannot work. But they still need health care. Even if you just take that theory and isolate the few people, they still need health care. They will still show up at our health care system. They still will get their care, and because it will then become uncompensated, it raises the cost for everyone else.
If I may, most medical students are on Medicaid because, and I would argue that they're working very hard.
And let me just say this about the work requirements, and I understand the mental attitude of they should work. Well, the vast majority of people who are working may not meet the work hour requirements. I was just talking to a woman who was telling me about her son who he's in his late 20s, doesn't fall under her insurance anymore, has been looking desperately for a job, got a job finally, but it's only 20 hours a week. He's on Medicaid. What's he supposed to do? We're in his little rural community. There wasn't anywhere else for him to work at the time. And he had been really working hard to do it. So Medicaid was taking care of him. He ends up in the hospital or at the doctor's clinic for whatever reason and doesn't have Medicaid because he's a few hours short, then he is paid for by everybody else.
What would you have to say in regards to Dan Newhouse voting in support of this bill?
Well, I would hope that Dan listens to the providers here. There is going to be a huge impact here in this rural region because of the reliance on many of our community healthcare clinics, and you heard directly from some CEOs here who are telling us that they just will not be able to survive.
Any other questions?
All right, thank you very much, and thank you. Oh, did you, was there anything?
Looks like one more.
I can't see. Oh, right you.
Kind of switching the topic a little
Yeah.
bit, but obviously the Texas legislature, in regards to their alleged gerrymandering of their districts to add some seats, do you have anything to say about that situation?
Look, I would hope across the country that people don't look at how can we rig elections in order to keep a majority. If you want to keep a majority, then go out and pass policies that people support. And I think it's deeply concerning that Texas is trying to gerrymander. I respect the legislators who aren't there. I know that, it may be very difficult for them to stop this. I hope that everybody, Washington State has a very good system of redistricting. It's a commission, it's not done by the legislature. And I really hope we stop going down this road of the only thing you try to do is keep power based on what kind of power you can get rather than doing the right policies to have people support you.
Thanks, everyone. Well,
Thank
now
you.
the podium and Jeffrey can hear.
I have one more, sorry.
Yeah.
So one of the responses that I've heard from the other side of the aisle is that, while there's this $50 billion included in the bill for rural health care, and that's supposed to help, address the inequities from what the Medicaid cuts would do. Do you see that as being part of the solution, or is that window dressing?
Total window dressing and very difficult. $900 billion in cuts and a $50 billion fix is nowhere near what it's going to take. This is not going to keep anybody afloat. And it is a fund that states have to apply for. I hope Washington State does because it's there. But the fact is, it is just an absolute Band-Aid that will not keep anybody afloat.
All right.
Okay, thank you.
We will just move the podium over and take a group picture.